Hi, my name is Ellison Lundy, and I'm a 2014-2015 student in the ISM program. This year I'm studying child psychology. Just a little bit about what ISM is. It's a mentorship class where the first semester we pick a topic of study, and mine was child psychology, so I studied child psychology all of the first semester. And I worked on conducting interviews with various child psychologists to expand my knowledge and eventually, hopefully, pick one of them to be my mentor. And I took ISM this year because I really want to know what I want to do when I go into college. And I know people go into college and it changes all the time. So I'm just trying to weed out what I want to do and what I don't want to do. And ISM has been a really big help with that. And I ended up actually loving child psychology. I'm also in a practicum of education class at the Kate Center, and I'm doing it for education. So I'm working with a kindergarten class, so I'm also working alongside a kindergarten teacher, and both of them, I love getting to work with both of them together because I can take what I learned from one mentor and apply it to the next. So it's blended together really, really well. My quote for this year is, "The purpose of human life is to serve and to show compassion and the will to help others." And this speaks a lot about why I want to be a child psychologist, because I want to help little kids who can't help themselves, who don't know how to voice what they're feeling or are too afraid to tell anybody, and I want to make them feel safe and feel open to talk to me so I can help them with their problems. My research assessments that I conducted this year, and most of these are at the beginning, first semester of the year. I learned about schizophrenia in relation to Capgras syndrome, and Capgras syndrome is where you think somebody is an impersonator of somebody else. Like, for example, I would think that's Lainey, but I know that looks like Lainey, but it's an alien that cloned Lainey and is pretending to be her to trick me, to get to me. And in almost every case of Capgras syndrome, they found out that the child or the person had schizophrenia alongside it. So I learned a lot about how diagnosing one disease can help lead to another, and if the patient is fully diagnosed, you can treat them better because you know what's surrounding them, and you can help prepare them for that through various therapies or medicines. I also learned about multiple personalities disorder, which is where one person takes on 3 different personalities. Most of the time they'll have 3 different names. They each think that they're somebody else. And there's typically the regular personality, which is who the person was born with and how they grew up before they developed the disorder. And there's a kinder personality who may be sort of more below their age. Like if a child has this and they're 9, they could act like they're 3. And there's also typically evil, negative personality that controls the other ones, and it knows that it has this disorder, and it knows that, and it takes advantage of the other personalities to kind of get what it wants. And so I learned a lot about different cases of different people who had it and different kids who had it, so that was really interesting to me. I also learned about the effect of trauma on kids, and I read a lot of case studies about the kids who their parents were murdered and they were going through grief therapy, and how their bodies will kind of regress in mental and physical stages. Like a kid who is 6 or 7 could start wetting the bed again, or kids can develop stutters because of the toll that this trauma takes on them. Lastly, I learned about group therapy in prisons, and how this doesn't really relate to child psychology, but I thought it was really interesting, and how it's a really big problem that the conditions that the therapy is conducted under, because the prisoners are set really far away from the therapist, and each prisoner is in its own, basically a cage that has different shields and different protection defenses for the therapist who's sitting across the room. And they're trying to help the patient, but they're also treating the patient like they're inhuman. So one of the solutions to this was, at some prisons you can have different have a desk, an individual desk that's bolted to the ground, and you can shackle the ankles to the ground and the hands to the front of the desk, so they can't go any more than the chain will let them during their therapy session. So they couldn't try to hurt the therapist, but the therapist would still have to sit really far, or pretty far away, so the prisoner couldn't spit on them or do anything to them like that. So they're looking for better methods that will treat the prisoners like they're people, to help them get out onto the streets and not make these same mistakes again. Throughout all my different interviews in my study, I learned a lot about different types of therapy that is used with children. My first one is play therapy, and basically it's how the child plays, and how they're feeling and what's going on with them is expressed through their actions, and it's not through their speech. Most of the time the child won't just tell you what's on their mind or tell you what's bothering you. You have to see how they play and try to bring it out in different ways, because if the child's distracted by a toy, they won't be paying attention to what you're telling them or what you're asking them. They'll just kind of answer with their subconscious. So the therapist can find out a lot from the child just by distracting him with the toys, or by how he plays with the toys. If he's aggressive, or if he's sad, or if it's really energized, you can find out a lot of different things. Because most of the time the child won't know how they're feeling, they won't be able to tell you how they feel. It's not just what's going on with them, it's how it's making them feel as well, what the effect on them is. And my mentor put it as, toys are their words and playing is their communication, which I thought was really cool. The second kind of therapy I learned about is art therapy, and this helps the child express their emotions. And if the child is really angry and aggressive during a session, the therapist could give them some crayons so they could really physically really hard scratch out on the paper till it eventually calms them down, because they get tired out by the repetitive motion of coloring with a crayon. Versus a child who's really happy or really sad, you might want to use paint, because it's kind of smoother, and it can, the way the colors come together can help express their emotions. So play therapy is kind of the umbrella that all the other therapies fall under, but art therapy is probably the second biggest one. The third one I learned about was sand tray therapy. This is where children will act out scenes, and one thing that my mentor does with this is she will typically have the child ask the child to depict what's going on in their life right now. So then and there's so much symbolism in how a toy is placed, or what toy is placed in which order, or where, or which way it's facing. And I've read a bunch of articles and books in a book my mentor gave me about it, but there's so much that you can find out from a child just by one sand tray. And then she'll normally talk with them and go over it with them, why did you place a fence here? Why was he pointing this direction? Did you notice that you had all of these characters, all of these people over here, and you're all the way over here? And they'll kind of discuss it and talk about it together. And then she'll tell the child to depict what their perfect world would look like, how would they want their world to look like. So then they'll move things around, and they can get new toys, and then they'll talk about that in different ways that they can achieve their goals. The last type of therapy I'm going to talk about is animal therapy. And my mentor has a therapy dog his name's Huey. And just having a dog there, he's been certified and trained. He's a very calming presence, and it can protect the child and make them feel safer. And if you're just sitting there like petting the dog over and over again, it relaxes relaxes the child, and it will help the child open up. And the dog's not going to betray you. He's not going to run away from you or bite you. So the children find a lot of trust in the dog, which helps them find a lot of trust in the therapist and allows them to open up. My first interview was with Robbie Heath, who was in her own private practice. It was just her, and she was a huge advocate for sand tray therapy. She told me that she wishes she could have a room just out of sand tray, and which I thought was really cool because I had never heard of this type of therapy before this interview, so I went home and researched a lot more about it. And she has a therapy dog come twice a week, and she'll schedule her clients who she thinks would really benefit from having a therapy dog with them. She'll schedule their appointments on the days that she knows the dogs are coming. She also does kid yoga therapy, which I thought was kind of weird, but she showed me her studio in the back of her office, and it was actually really cool. She's got like little kid yoga mats, and then she's kind of got like waterfall sounds going through it, and she'll recommend that kids come to a certain amount of sessions in between her therapy sessions, just kind of relax them if they're really stressed or angry. My second interview was with Allison Scholes, and she was just starting out becoming a fully licensed therapist. Right now she is licensed through grad school, but she's still getting her 3,000 hours, which finishes the licensing. And a therapist, after they graduate, they need 3,000 hours of talking with another certified therapist that's also certified to talk to them. And they sit down and they talk about their cases, and she's a really light caseload. They sit down and they talk about their cases and what she said, what Allison said, and then what she could have said, and just different ways to go about it. And the other therapist will help her kind of know what to say and know what to do, and just fix the mistakes along the way, and just make her a more well-rounded therapist, so she doesn't have to figure this out as she goes, and she's not alone in it. She was a really big advocate for filiotherapy, which is working with the child alongside the parent. And most of the time the parents, I don't want to say are the cause, but they're a big reason why the child is going through what they're going through. And the parent needs to be able to see that in order for their child to change like they want them to, that they need to change too. And it's going to be a family effort to better their child. And she was very new to a private practice. She'd only been working there for a couple of months. My third interview was with Erica Meek. She'd been a mentor 2 times before. One last year to a girl here, and then a few years ago to a girl at Wakeland. And she's the one with the therapy dog named Huey, and he's adorable. When I went into my interview, I was really nervous because she had been a mentor 2 times before, so I figured she'd know like what to grade me on and what I was supposed to say. So I sat down on the couch, and Huey jumped up in my lap, and he wanted me to pet him. So it just kind of calmed me down, and we were able to have a really good conversation. And one thing that's really cool about her private practice is she is not the main owner, but one of the main people that facilitates everything. So she gets to choose her own work schedule. She only works Mondays, Tuesdays, and Wednesdays, so she can be with her child who's in preschool the rest of the time, which I thought was really convenient and interesting. My fourth interview was with Holly Lockett, who has a background in criminal justice. She was a policewoman for a long time and worked a lot with law authority. And she became a therapist because of her niece. When her niece was 9 years old, her niece lost her father, and the therapist she was seeing eventually told her to get over it and that he's not coming back and there's nothing she can do, so she might as well move on. And she just saw how harsh her niece took that, obviously. You can't just tell the child who lost their dad 4 months ago to get over it. And she saw that there was a really big need for therapists, so she became licensed, and now she works in a private practice. She actually works with Ellison. And she works a lot of high-profile divorce cases just because she knows so much about law enforcement and because of her background in criminal justice. My fourth interview was with Edwina Townsend. She was a school counselor, and she was a school counselor and she worked in a private practice, 2 different private practices actually. And I learned a lot about all the restrictions that are placed on school counselors. They can't really talk to a child like a private practice therapist can, because there's a lot more guidelines they have to follow. They can't tell them certain things. They can't comfort them certain ways. They can't do certain types of therapy that are really beneficial to kids. And they can only see the child 4 times before they need to recommend them to another therapist if that's what they think that they need. So I talked to her more about the school counselor side because I had heard from 4 private practice counselors already. My interviews overall, what I learned was how effective play therapy was. It's really crucial when working with kids. There's not much. It's going to be really hard to get where you want to get to with the child if you're just talking to them. They need to be able to open up and to relax and be stress-free through the play therapy environment. And the grad school at UNT is a really, really great program. 4 out of 5 of the people I interviewed all went to this grad school, and they got to study under Dr. Landreth, who was the inventor of play therapy. So you're learning right from the source, which is a really, really awesome experience and a great learning tool. I also learned about working with parents and how crucial that is. Like I said earlier, that the parent needs to change for the child to change, and that it's a 2-way street, and they need to work alongside the child. This is my mentor. I picked Erica Meek. I chose her because she had the most experience out of everybody that I interviewed, and she used a lot of different methods and combined them together. She doesn't just stick to one way of thinking for therapy. She explores all of them and pulls from different methods for each child. She makes it really individualized, which I really liked. And I thought since she had been a mentor before, she would kind of know what I needed to get out of the experience, and she does. She's been awesome. And she has a dog, and he's really cute. For my mentor visits, I learned a lot about sand tray, and I'll go over that in just a minute. And one thing I did during my mentor visit was I got to go through her playroom. She showed me every single toy that she had and what would work best in some situations. And she went through most of our mentor visits are about her telling me a case with a child, and then she tells me like how she goes about it, what different methods she used, how she talks to the child. So she told me I got to learn a lot about her other patients just through looking through her playroom, and what was most effective, what wasn't effective, when she felt like she needed to take a step back because she pushed the child too far and they started to shut down, and then how she got the child to open up again. And then she talked to me a lot about grief, because that's what my original work has been over, and I'll go over some of that in just a few minutes. I got to observe one of her sessions with a little boy named Cody, and that was probably the coolest mentor visit for me, maybe besides the sand tray therapy, because I got to see how she interacted with the child and see what she said and see how he reacted, and I got to really see play therapy in motion. And during that visit, Cody was really nervous for his STAR test that was coming up because he wasn't finishing on time during all of his practices. And I got to watch them. I sat in a chair in the corner of the room, and she pulled him aside before they went in there, and I was already inside, so he would know that I would be hearing it. But she told him that she gave him a signal and said, use the signal if you want to tell me something, but you don't want her in the room because you don't feel comfortable. Just so he feels really comfortable all the time, and he can talk to her truly about anything that's on his mind, and he doesn't have to be embarrassed, because she told him that I'm here to watch her, not to watch him. So he won't be what I'm focusing on. I won't be judging him. But if he does need to tell Miss Meek something, that I will step out of the room, and that's totally fine. He didn't use a signal at all times, but I liked how she made him feel like he was in a really safe, trustworthy environment. And for his STAR test, they went over a book using Monsters University test monsters, and which is really helped him because it's one of his favorite movies. And they went over like, what's your test monster, what like holds you back from doing well, and his was the time monster because he wasn't finishing on time. And they went over different strategies, and I actually learned a lot from it. I learned that if you look up and to the left when you're trying to remember something, oftentimes it will trigger your memory because of the way your brain is wired. That's where the memory of like certain things that you've learned and studied will help pick up. So I'll have to try that out. AP tests are coming up soon. And lastly, we did a lot of planning. We planned for my original work, and we planned for my final product, and we were just trying to get everything together. This Monday we went to Hobby Lobby and got all of my supplies for my final product. So we made a schedule, we've been planning, we've been sticking to it, and so all of it has turned out really well, just for how much we've been able to get together and sit down and make a plan for everything that I have going on ISM wise. And then back to sand tray. So she had me do a sand tray for the kids that I'm going to be working with for my original work. I went to Catacamas, Honduras this summer on a mission trip, and I really fell in love with the kids there, and I thought that ISM would be a perfect platform for me to help out these kids. And like, I couldn't imagine doing anything else for my original work than doing something to benefit them. So I did a sand tray for what their life was like now, and then what they wish their life could be. So this is an example for one of the kids I met, and I won't go over it completely, but the main focuses of the sand tray was they didn't have food, and their father was in jail, their mother was gone, and nobody would give them food. There are wealthy in these parts of Catacamas because they're the drug lords who run everything over there, and they don't care about all the poverty that is in Catacamas, so they're not going to help out these kids, and the farmer isn't going to help out these kids and he gives this child, his name is Antonio, he gives him food for his brothers that he takes care of. Sometimes, like, he'll give them the scraps, and that's what the tomatoes are, the old leftover food that he wasn't going to make a profit off of, because the economy is so bad there that every cent counts. And so while the farmer wants to help these kids, he can't, because there's not enough of a food surplus to be able to do that. And then this is what I wish my life could be like, and all the borders are taken down. The dad's back with them, the mom's there, the farmer's sharing the food, the rich people are sharing their food, and the child just feels like he's not alone anymore. So it was really, really cool. This was probably one of my favorite mentor visits, just because I got to do this myself. I also did a sand tray. She had me do a sand tray about AP testing coming up. It turns out I'm really stressed out about it. But, so it was like really, really, I really loved doing this. It was really fun. For my original work, I kind of went over the children that I'll be helping through my I'm going to be making care packages for them for children in grief therapy who have all lost their fathers. And they've all lost their fathers due to the same situation. Their dad had to become a paid assassin for a drug lord just to make enough money for his kids and to put food on the table. But I knew this would take a lot of research going into it, so I turned it into an original work final product collaboration so I could get all of my research out of the way and be able to focus on the actual care package for my final product. And so the supplies that I'm going to be needing, I need drawstring bag, colored pencils and sharpeners, a composition book, money. I need instructions for the activities that I'm going to translate into Spanish, and just some extra fun things because these children, they don't have anything that is their own. It's all shared, or most of them have one pair of clothes besides their school clothes, if they have school clothes at all. They can go to school as long as they can afford the uniform. So most of these kids are wearing uniforms that are 3 years too small for them and don't fit them anymore. And then they may have one pair of clothes to change into after school is over. But that's what they wear all the time. A lot of them don't have shoes. A lot of them, they don't have anything that is their own. So I wanted to give them something that is completely theirs. And I was also going to give them, because they are grieving, the art supplies is part of the art therapy for them. But I'm also going to include, I was going to do memory blankets, which is what the fabric and Sharpies are for. But the fabric, and what they would do is the child would write down all the good things and the good times that they had with their parent. So when they missed them, they could literally wrap themselves in the memories of their parent. But the fabric was going to be way too heavy, and the money, or the Sharpies, cost a lot, and I couldn't find any cheap permanent markers that would be able to write on the felt fabric. And because most of their houses are rocky or concrete, the felt fabric would pull apart and it wouldn't end up staying together. So we rethought that, and instead we're doing 2 different activities. One is with clothespins and yarn. That's all they need. And I've been cutting yarn and sorting clothespins all week. And it's a little worry doll I have here. And it's to help the child remember their parent, and they can put this little figurine of the worry doll when they're having a bad day or they've had bad nightmares. If they put it under their pillow, it can help take the bad dreams away. And that's actually something that's pretty prevalent in their culture. I saw a lot of worry dolls when I was over there, but I thought this would be fun because the child could personalize it and make it their own. And then I'm also doing bracelets where each bead is we're gonna have these written out in Spanish so they'll be able to understand it, but each bead is gonna represent something. We haven't picked a symbol for all the beads yet, but the red bead is gonna, for example, symbolize like how much their parent loved them, and then the yellow bead will be all the good times they had with their parent. And we're just gonna have them write down different things to remember about their parent, and we're gonna have them write them down in one of their composition books just so they never forget them and they remember what the beads symbolize, and they can always keep their parent close with them. And like the star bead is gonna represent their parents themselves, so they can, even when they grow out of the bracelet, because these kids, well, they grow pretty slow because of how hungry they are, but once they grow out of the bracelet, because a lot of them are really small, they'll still be able to remember it and they'll have it forever. And raising money was going to be a big part of it. I was going to pass out flyers at my therapist's office and my dad's office, and I also asked a lot of friends and family, and I put a GoFundMe account out on social media, And GoFundMe is really cool if you need to raise money for something, because it has one link and you can send it out on, I had my mom send it out on